In this video we are going to help you understand tennis elbow. I'll explain what it is, the typical signs and symptoms and how you differentiate it from other similar problems. Now make sure you stick around to the end as I will be sharing with you 3 simple ways to help ease the pain and manage tennis elbow. Hey and welcome to Envisage Physiotherapy. My name is Matt Hall-Naylor and my aim for this channel is to empower you to look after your own health. One way of doing that is to give you the basic tools needed to understand, diagnose and treat typical conditions or problems that you would normally seek physio for. Now, using some very easy and basic methods, we should be able to gain a better understanding as to what tennis elbow is, but more importantly, how best to treat it so you can spend less time worrying and more time getting back to the things you love. So what is tennis elbow? Well, tennis elbow is a condition that affects the muscle, but more specifically the tendons of the common extensor wrist tendons. Now they attach to the outside of the elbow and it's usually characterised by pain when using the hand or doing weight-bearing activities. Now you may find that the symptoms just start out of the blue with a general achy type pain, but it commonly occurs when performing or doing some sort of repetitive type activity, say polishing a car, painting and decorating, kneading dough, or plastering or something like that. And basically what's happening is the tendon is just responding to the overload and telling you that it's done too much. Now bear in mind that despite it being quite frustrating to experience, tennis elbow is not a worrisome condition and will in most cases resolve. Some research does suggest that it can take around 12 months, but in my experience it can resolve much quicker than that, but it has to be managed correctly. So what are the signs and symptoms? Well, the most common symptom has to be pain, and it generally starts with a low-grade ache when you're completing a specific activity that generally involves the repetitive wrist extension. Okay, so you might find that if you continue to push through this pain, that it intensifies and progressively worsens, which then results in experiencing a latent pain, or in other words, it's basically a pain after you've stopped the activity that's provoking it. Now the location of the pain can vary slightly, but you'll generally find it within 3 different areas. First is a bony prominence on the outside of the elbow, and the location can be easily found if you extend your arm, just roll over, and you'll find a little bit of a bony prominence right near the elbow joint, and generally that is quite tender there. Now another location is actually over the muscle belly of the forearm, and these are the extensor muscles that are involved in extending the wrist like this. And the third spot is generally a little bit higher than the first spot, so it's just above the joint line, again over a bony prominence, but you'll find that that could be a little bit uncomfortable or tender. Okay, so the condition is known to usually affect roughly 1%, 1 to 2% of the population, and generally targets the most dominant side. Now, as you can well imagine, because you're using that side more regularly, then it stands to reason why it targets that side. It more commonly affects people around the ages of between 35 and 54, and both males and females are equally affected by tennis elbow. Now, in general, you tend to find that the people, or the demographic of people that tend to experience the problem with tennis elbow is those that have repetitive lifting jobs, repetitive gripping, such as tennis, rowing, those that work in the construction industry, lifting lots of boxes, assembly line work of moving regularly and repeatedly. And also you sometimes find that those people that are operating vibrational tools, can sometimes experience it. And that's generally because what's happening is that the person is gripping really tight and they're in this, what we call an isometric. The muscle is holding itself really, really tight there and there's no give, it doesn't get any respite. Now, in addition, another potential reason is those people who have had either previous trauma, they've got shoulder conditions, or they may well have just a general underlying weakness of the shoulder of the same side. And this is because the muscles of the wrist and forearm start to be compensating for the weakness of this muscular structure in the shoulder area. Now, if the symptoms do progressively worsen, you may well start to experience a restriction in both the end range of the flexion and extension of the elbow. Now, it's not the most common experience because generally the condition gets better before this sort of thing happens. And it's worth bearing in mind that the reason this happens is purely because of the tendon and the muscular structure causing the restriction, rather than it being a restriction of the joint, the elbow joint itself. Now, how do you test for tennis elbow? Now, there are some specific signs and tests that you can use to potentially diagnose tennis elbow. And in essence, the more of these tests that are positive, then the higher the probability is that you've got tennis elbow when used alongside a really good thorough history of the problem. Now, one of the first tests is what we call Cozen's test. And that basically is a test that we do and we perform with an outstretched arm. So the shoulder, the elbow and the wrist are all outstretched. You bring the arm over, okay, so the palm is facing the floor. And what happens is you have to use your other side and you apply pressure to attempt to push the wrist down. Now, what happens with the affected side is that we're resisting against that movement, therefore activating the muscle, and it should reproduce the symptoms on the wrist. I beg your pardon, it should reproduce the symptoms in the elbow. The second exercise or test is what we call Maudsley's test, and this is in exactly the same position, but instead of resisting the wrist, what we're doing is resisting the finger, the middle finger, okay? And the third test is what we call Mills' test, and this is basic what we call passive flexion, wrist flexion with an extended elbow. Exactly the same position once again, so all these three tests can be performed in the same position, and what we're doing is we are actually using the other side to stretch the wrist down into flexion. And what we're actually doing with this is the muscle that is irritated is in a relaxed position, and what we're doing is we're actually stretching it. We're putting it on a stretch, so the fibers are stretching. And under tension, you might notice that the pain starts to become evident. Now, if all of these tests are positive, then that's a real sort of good indicator that the problem could well be tennis elbow. Now, obviously, there are other things that we can look at, and that's location of pain, so touching that location that we were mentioning before. And what you also might find is that you could end up developing a slight reduction in your grip strength. Because of the area of the muscle that is affected, you will probably find that your grip strength starts to become reduced. Now, that's generally because of the pain, so you will not want to grip or lift heavy objects due to the pain. If you start to notice that your hand is losing grip and strength for any other reason and not due to pain, then it's unlikely to be tennis elbow, and I would highly recommend you get that sorted out by a doctor or a physiotherapist. So that leads to the treatment and management. Now, the real trick in managing conditions like these is to understand the behaviour of the symptoms and what could be causing the problem in the first place. Once this is achieved, then the management consists of the following. Really important, reduce your activities that's causing or triggering the pain. And the reason I say that is because if you don't manage the conditions and reduce the conditions or activities, then the likelihood is the pain can get worse, and it will last a little bit longer, and it's the potential that your symptoms and the condition can go on for a longer period of time. Now you've also got the option of utilising pain relief, so any sort of over-the-counter pain relief, anti-inflammatories can be used. Occasionally people have got some relief from a steroid injection, so that could well be an alternative, but bear in mind again, a steroid injection is an anti-inflammatory, and it only generally works if there is an inflamed process that's causing the pain and symptoms. Acupuncture is also another adjunct, but very similar to the corticosteroid injection. Really, it's only going to work if you have got some sort of inflammatory component. Another alternative is something like heat and ice, just to calm the area down a little bit. And what I would suggest is, if you're really feeling that the symptoms are inflammatory, then it's probably not a worthwhile thing to actually apply heat to it. And the reason is, what you're doing is you're adding fuel to the fire. So I'd always suggest utilising the ice option rather than the heat option. And if you want to know any more information about what an inflammatory response is, please see the link below in the description. Now what you can also do is try using a brace or an elbow support. And that can sometimes help with the pain, especially when you're using the arm for any sort of functional activity. Now another option again is physiotherapy, and what we do from a physiotherapy standpoint is go into a greater depth with regard to your history. We get to understand you, what you do with regard to your tasks and your function, and then allows us to build up a really good understanding as to what the problem is and whether we've got the diagnosis right. What we can then do is offer a really good management plan, which may well include managing what you should or you shouldn't be doing to reduce the likelihood of it getting worse or increasing the pain. And alongside that, we can also give you guidance on strengthening exercises, which really is one of the important factors of trying to rectify this problem. Now, whilst the above can be used as adjuncts to help with pain and lifestyle, the very best way of managing tennis elbow is getting expert advice and guidance. If you require any clarity on the diagnosis or management of the condition, then it's always wise to speak to a suitably qualified healthcare professional like a physiotherapist. And if you require a consultation with myself, my contact details are down below, and feel free to give me a quick call where we can discuss your needs further. And next, on to the strengthening exercises. Now it's worth bearing in mind that what we need to do is start off with very low grade resistance to begin with, because if you start using too high a resistance, it's highly likely that you'll provoke the symptoms that we're trying to improve. So what we're going to do is place our arm on an outstretched bench or the arm of a chair or a table, dining room table. Relax your arm in this position with your hand hanging over the edge. What you then need to do is bring the wrist up so the muscle's in a shortened position. What you then do is get a small 33cl water bottle. I know this is a little bit bigger, or you can get a 1 kilogram dumbbell. You then use your other hand and place the weight into the affected hand. You then slowly drop the hand down until it gets to the bottom. Use your other hand to take the bottle out again, bring your wrist back up to the start, and in essence you're repeating this very simple exercise. So I would advise doing 3 sets to the limitation of pain, so it might be 3 sets of 7, 3 sets of 10, 12, 15. As you progress the exercise, you'll start to realise that the tendon becomes less painful, and you'll be able to tolerate more repetitions as you start to see an improvement. It's really important because at the end of the day, this exercise has been shown to be really effective, but you need to be doing it for a 6-week period. And now for the bonus, 3 tips to help ease the pain and treat tennis elbow. Now this is really important. Tip number 1, moderate your activities. It's so important in being able to manage the condition in a timely and effective manner. So what things can you do? Well, you can utilise a little and often approach. And what do I mean by that? It's basically if you're doing something like a functional activity that's provoking the symptoms, do it over a shorter period of time, but do it more regularly. So instead of spending like half an hour doing it where it's going to flare the symptoms up, spend 10 minutes, give it a rest for 10 minutes, then do it again for another 10 minutes. What you can also do is reduce the resistance behind the activity. So if you're doing a lot of lifting work and things that involve this wrist extension, can you try and reduce the load a little bit? But sometimes it may well be possible to use your other hand for the tasks. Another good example is to ask for assistance, ask someone to help. So again, if you're lifting a heavy load, instead of just battling through it yourself, try and get some assistance to help with that. And one final thing, listen to your body and stop when the pain increases or persists. Tip number 2, strengthening. So important. You've got to be really vigilant and focus on the exercises, because ultimately the cause of the problem has been likely due to the muscle not being conditioned or strong enough to do the job that you're asking it to do. And tip number 3, utilise advice and guidance. Seek advice and guidance and take it on board. Look, after all, it's for your benefit. Granted, you may feel it doesn't fit within your calendar or your social life, but ultimately, you've got to find the time to manage the condition. And trust me, if you do, you'll be rewarded. Now, I really hope that you found this video useful. And if so, please press the like button. If you're new here, don't forget to subscribe so you can get more informative content to empower yourself. Now, some very helpful links to any resources that I've mentioned, and you can find those in the description below. And I want to make this channel as interactive as possible, so please do leave a message in the comments section. Tell me whether you found the video helpful and useful, and please do ask any questions and I'll get back to you whenever I can do. And one final thing, if there are any topics or burning desires that you think that you would like to know about, put them down in the comments section and I will look to cover those in future videos. And remember, you can book an appointment with me for a one-to-one diagnostic consultation. Again, the details are here and they are down in the description. Or you can download a more in-depth free fact sheet on tennis elbow using, again, the link in the description below. For now, thanks very much for watching and I will see you in the next video.